Hey everybody, it is April 5th, 2020, and I'm Tonya Shepherd Hatfield. I'm a nurse practitioner here in southeastern Kentucky, Floyd County. Um, I do these videos just to kind of recap where our community is on these particular days. We've done a few of these. I give people a chance to ask their questions. I throw out some phone numbers. Anyway, right now we're in the midst of this coronavirus, and so far Floyd County doesn't have any positives, which I don't know if saying that Floyd County doesn't have any positives right now is a good thing or a bad thing, because the community seems to respond more appropriately to the crisis at hand when they are literally told that, hey, you've got a positive, confirmed positive. Well, here's the thing. We live in the hills of Appalachia, and I know that we have county lines and we have county um, health departments, things like that. But the thing about it is anything that happens in one county here in Southeast Kentucky is happening in all of them. We always need to respond to everything as a region. So right now, our region has confirmed positive um, coronavirus in Martin County, Lawrence County, Pike County, Johnson County, Perry County, and Breathitt County, which is all around us here right now. Now, there's a few of us, if you look at the map, it's still showing that there's no confirmed positives in those counties, but it's in them. It's just not, I don't think that the hospitals around here, they're either not testing enough or they don't have enough tests to really get what they need to get sent out to catch this. But it really doesn't matter, because if it's in Johnson County and it's in Perry County and it's in Pike County and Martin County and Lawrence County and Breathitt County, it's in Floyd County. So all you people thinking, oh, we're safe because it's not in Floyd County, no, you're wrong. It's here. It's here. And if you think that it's not, then you're part of the problem that we're having when I go out in public and I see what's going on. People are still. I was sitting at Food City last night and sitting in the car, and Brandon went out and went into the store wearing his mask. And I sat there and I watched the people, and there was like barely anybody wearing a mask, although the CDC now recommends it. I said it last week. Um, Barely anybody's wearing a mask. I saw a whole family go in, and they made like 4 trips in and out of the store with teenagers. They had like 3 teenagers with them, and they were just back and forth in the store. That don't need to be happening. I don't know if maybe they don't know or what. Okay, and my hands are clean, and I've got this quarantine frizz going on, so just look over me pushing my hair back out my face. But even though that our county elected officials are saying that it's not here, you better believe it's here. We've just not found it yet, but it's here. So need to treat it like it's here. We need to continue doing our social distancing, washing our hands, using hand sanitizer, using our Clorox wipes. Leave your shoes on the porch. Don't hang out with anybody that does not live with you. That's just the only way you're going to protect your family and your friends, is you don't hang out with anybody that don't live with you. Do not get in the car with somebody that does not live in your house and ride down the road. I don't care where you go. Just don't do it. Not right now. Wait till all this is over and you can go with whoever you want to. But right now, in order to protect as many people as we can't be doing that. So now you need to wear a mask when you go out. When you go out in public, you don't have to wear it when you're like driving down the road or anything. But when you're going out in public, then put your mask on. This is a homemade mask. I gave a shout out to Marianne Prater. She made this for me. So this is one of mine. This is a cotton mask, and I've got coffee filters down in it. I don't know how many. I've got a bunch. I grabbed a bunch and put that in there. But it's better than nothing. It's going to protect anybody that I'm around, because I could have got exposure. I don't know. I'm not sick, but I don't know. I could be carrying it, and I just don't know. So I'm protecting whoever I get around from me, and it's also protecting me somewhat from them. So you need to treat everybody like they have it, and then you act like you've got it and don't want to give it to anybody else. One person per family shopping would really help. I know that they've cracked down on that at Walmart, the grocery stores, places like that, but apparently Food City, as of last night, wasn't doing that. They need to deal with that. I know everybody needs their groceries, but you know, the whole family don't have to go. Leave your kids at home. Do not leave don't take your kids out. Just leave them at the house, because kids can carry this. They're not really getting sick with it, but they can carry this and they can give it to other people, or they can spread it by touching everything in the grocery store, and then somebody goes behind you and picks that up. So just leave your kids at the house. Stay 6 feet away from people. You know the drill. I've been saying this for weeks. They've even got, in the bigger cities on down the road, we've got the field hospitals are going up. They're actually setting up hospitals under the big tents in, like, the training football field at UK, the one that they practice on. They're putting a field hospital there. Louisville is setting up a 2,000 bed hospital in there where they have the state fair and the fairgrounds. 2,000 beds. 2,000 beds in a field hospital. That's not even counting the whole hospital system they've got down there. So they're trying to prep. I don't know if they're prepping that for COVID, or if that's going to be for people that's not sick, because the hospitals are going to be overrun with this. It's starting to increase here, and it's still got to go up here, because we're not going to peak for a while. Nutter Field House, yeah, that's it. I couldn't remember what it was called. Thank you, Adam. I should have known you would know. People have been asking me about the drive-through testing, so I've threw out some shout-outs to people that I know. And I hope most of y'all understand, my experience goes back to the mid-90s. I've worked in all of these hospitals around here, and I've worked in several hospitals in Lexington. So I've got a pretty far reach when it comes to knowing people in places. So, and I don't care to ask, and they know I don't care to ask. So, and most of them don't even care. If I ask them a question, they're going to tell me. They're going to tell me what's going on, because this isn't a big secret. And I don't know why that these local hospitals aren't speaking more to the public about these things and talking about it in a way that we can, we as a people can understand, and know what they're doing and know what to expect. So, okay, they're all getting their ventilators together, they're getting their equipment together, and they're getting all this, but what they are not saying is we only have so many beds here. We can only handle so many patients. We only have so many ventilators, and that's not many. Between Pikeville and Hazard and Highlands and Paul B, and even as far down as Three Rivers, I don't know. Martin probably has a few, but I don't know what they've got. McDowell, they're not going to have that many either. I mean, you could probably count them on one hand. But we only have so many ventilators. And if people don't start staying home and taking this more serious, we are not going to have enough ventilators for the people that are going to need them. And from what I have been seeing, there's a whole lot of these people that once they get to the point that they need the ventilator, there's not that many coming back off of them. So you need to take this serious. They're trying to prep for the ventilators, and that's great. And there's going to be a lot of us that are going to get this and we're going to get sick, but we're just going to get sick and we're going to be laid up for a week and then we're going to get better. But then there's going to be those of us that are going to get sick and we're going to need that vent. So, the less that we can spread this, the better off that we are going to be as a region of people. Our mountain people are some of the sickest in concentration anywhere. We've suffered from, well, first off, we got our coal miners. There's an article floating around now on Facebook I saw talking about the coal miners. I said that 2 weeks ago. We've got the coal miners with their lung issues. They're going to get hit hard. We have to protect them. We've got the smokers. We've got tons of smokers. Obesity is a risk factor. Any kind of lung problem, anything that it makes you immunocompromised. If you have cancer, if you had cancer, if you have, Crohn's disease, if you have diabetes, if you have cardiovascular, if you've got heart problems, you are at risk. So just if you can keep from going out, if you have one of those things I just said, then if you can keep from going out anywhere and you've got somebody else in your home that can do your shopping for you, you're going to be much safer that way. Just make sure that whoever does the shopping for you washes their hands, takes their shoes off when they come back in the door, and they need to wear a mask when they're out in public. Don't let your ego keep you from wearing a mask. Don't think you're above this, because it's coming after us all. Some of us is just going to be luckier than others when it comes to be getting sick. The drive-through testing. These hospitals around here are going to start up some kind of drive-through testing. I heard maybe this week, but they're not going to be able, you're not going to be able to, everybody in the county get in the car and drive down there and get tested. That's not how it's going to work. They're going to have to get some kind of a schedule in place, and they're going to be limited on what they can do each day, because the couriers can only carry so much. I don't know where the testing's going to be, but this is coming, and that way that's when we're going to see all of our positives, when they can actually test people. Here's something. Oh, Italy. I know I started my videos, the very first video, Italy was what prompted me to start these videos, just seeing what was going on over there. The doctors with President Trump did say today that it looks like they've probably peaked, and their numbers are starting to trend down. So they're still having positives, new positives come up, but they're not having as many new positives show up as they were. They're not having as many deaths per day as they were. I hope that's a good thing. I hope it don't start trending back up, and I hope, and they're locked down. They're locked down tight. Not like we are here. People still wandering around, ain't got no business being out in public. Don't be hanging out with your buddies. Lock your teenagers down. Don't let your teenagers be out running around doing their thing, running to their girlfriend's house and going to their buddies and all that. Stop them from doing that, because we have got to get a handle on this. Something that has not been talked about, and none of the local doctors might be addressing some of this, but I've not heard them talk about it. I've not seen them on Facebook. I don't know why they're not. If you can actually get one on a telehealth monitor, maybe it's something that you can talk to them about, because they're definitely not coming out public and talking about it. I saw Dr. Chaffins the other day talking about it, but he really never said anything that I haven't been saying. We're all saying the same thing. You've got to pick one. You got to listen to somebody. But advanced directives. I know y'all have heard that term. If you've ever been in the hospital, it may have just been a question they asked you and went on, and nothing was ever really addressed about it, but some people want to know what is an advance directive. An advance directive is a documentation of what you want as a person for your end-of-life care, how you want that managed. Who do you want to make decisions for you when you can't make decisions on your own? You need to talk to your families about that, just in case you are one of those people that needs that ventilator. Or in any situation, you need to talk to your family about what your final wishes are going to be. And I'm not talking about life insurance or anything like that. We're past that right now. You need to talk to your family about how you want things carried out if something happens to you. I've kind of hit on that a little bit with my husband in case something happens and something happens to me. But I mean, it's something that you need to talk to your families about, especially if you are older and you do have a lot of these comorbidities and you've still got people running around out in public and they're not doing what they're supposed to be. You need to talk to your families or write it down. Don't even talk to them about it, but write it down somewhere and let somebody know where that is. In case something happens to me, this is my list of what I want done. This is, I want to be on life support. I don't want to be on life support. I want Sister Sue to take care of all of the decisions with my health, and then, or I want my wife to take care of everything. Let her make all the decisions. You need to address this. Address whether you want CPR. Even the ventilator. I mean, do you want the ventilator? There's people, older people that are choosing, like there was a priest in Italy that chose not to have the ventilator because he was old and he wanted it to go to somebody else. Now, when you just start talking about end of life decisions, that gets you to that brings up all kinds of thoughts that run through your head. But these are things that you need to be thinking about and you need to be working through. But think about it, because you might be faced with this in the next few weeks. I hope not. I hope nobody I know is faced with this. But you might be. And if you are, then you need to let somebody know what you want. Even right down to the funeral home that you want. Because if people don't start following the rules that we've got right now to try to protect each other, people we know and people that we love are going to be faced with having to make these decisions. So figure it out. Figure out what you want. Figure out your funeral home. Figure out where you want to be buried. Figure out if you want that ventilator or not. Figure out who you want to make decisions for you. Scary times, people. I'm sitting here telling you to tell your significant other or your boyfriend, your girlfriend, your children, your whoever, what funeral home you want in case this takes you out. Because our community is not completely locked down. And if you go sit in a parking lot somewhere and watch these stores, you're going to see that it's not. So people still out there spreading this virus. Okay. I'm going to check over here and see if I've got any questions. Yes, Doris, your husband is definitely at risk. He's got all that going on. Okay, I don't see any questions over here right now. Okay. All right, I want to run through my links. If you guys got any questions, throw them up at me over there. Okay, ARH COVID-19 hotline, 7 a.m. to 11 p.m., 606-439-7100. This is our local people. This is ARH. We've all here in this region that I was talking about have an ARH. So if you need to know what to do, if you're sick, if you're having symptoms. Now, if you think you're having a heart attack or whatever, you still go to the emergency room. But if you can avoid going to an emergency room right now, then don't. Just call this number or call your doctor's office or whatever and tell them what's going on, and they'll give you instructions on what to do. But this is the local ARH hotline. So you call that if you've got any questions, and they'll tell you what's going on. This is the coronavirus map that I look at that tells me what is going on in what country, and how many positive cases they have, how many deaths they've had. Today the U.S. had 337,000 positive cases in the United States. This was just a few minutes ago when I looked at this. And we have had 9,619 deaths in the United States. I think that's what I saw. Let me look. That's a lot. That sounds like a lot. We've had 1.2 million positive cases in the world. According to this, since all this started with the that can be attributed to the coronavirus, according to this Johns Hopkins resource thing, is 9,633. Now, Italy has had 15,887 deaths up to today. We're at 9,600, and it's not even peaked through here yet. New York ain't even done. So this right here, that's the map that I get those numbers from. coronavirus.jhu.edu/map.html. You can go look at that yourself. I've watched different countries. I watched, like last Saturday, Madagascar didn't have any. And then last night, I think they had 60 or something like that. Madagascar, little country off the southern tip of Africa. There was 6 cases inside the Vatican wall. Inside the Vatican. The little Pope is over there probably in that bubble car, sleeping. This is the governor's site. This is the Kentucky website, and it's got like there's a map on there that's got each county marked that's got cases in it and the ones that don't. So you got kycovid19.ky.gov. This is the chart on there that tells you when to seek care. It's got the number right here, 1-800-722-5725. Call that number if you're from anywhere in the state and you've got questions about when I need to get treatment, then that's the number you call right there. Kentucky Safer, 833-597-2337. If you see people congregating that shouldn't be, if you see businesses open that shouldn't be, this is the line that you call and report that and tell Andy. For our local area addicts, this is the grassrootsna.org. This is the that's the website. This is the number, 855-319-8869. If you are having a problem with addiction and you need help, this is the number that you call. They will tell you where the meetings are. They will tell you how to log on to those. So if you need anything, this is the ones that you call right now. The National Suicide Prevention Hotline, nobody is talking about this, but this is an issue. Floyd County, this should hit kind of hard right now. 1-800-273-8255, suicidepreventionlifeline.org. So if this is something that you've got running through your head, then this is where you need to be calling right now. You need to reach out to these people. You need to reach out to a friend. Everybody is in isolation. Everybody is sitting at home. Some people are sitting at home by themselves, and being at home and being depressed and not being able to get out is bad enough. But when you're sitting there inside your own head and you've got issues that are making you feel like you need to do something to hurt yourself, you need to call that number and you need to get somebody to help you. So this is coming. It's getting ready to get real. The local providers and the hospitals may not be stressing it and throwing it out there the way that I do, but that's why I say it the way that I do, because I don't sugarcoat. And any of my patients that I've had over the years will tell you that I don't sugarcoat. I've worked ICU for a long daggone time, and then I've been a provider for a long time too. So I tell it to you straight up. I tell you with the information that I've got. And I want to protect my people. I want to protect my parents. I want to protect my family. And I want everybody else to want that same kind of stuff for theirs, because the more people that's out there protecting themselves and protecting their families are protecting mine too. Let's see. Okay, I don't see any questions over here this evening. So if anybody has any questions about anything going on, if I don't know the answer, I'll look it up, throw them out to me, send them to me in a private message, comment on this video. Just like Andy says, we're going to get through this, and we have to get through it together. We have to do all this together. But if everybody don't get on board, then we're going to come out on the other side of this with a lot less people still standing than we could have. So teach your families. And does bronchitis fall in those serious areas? Any kind of a lung condition, anything. If it's a chronic bronchitis especially. Anything lung-wise is going to put you at a higher risk. So people, stay home. Stay home, wash your hands, wear a mask if you have to go out in public. If you don't have a mask, use a scarf. I don't care if you duct tape a dish towel around your head, cover your mouth and your nose, or somebody's going to cough, and you're going to walk through their cough fog, and then you're going to have it, and then you're going to take it home to your parents or your children or your brother or your spouse. And then they're going to go to work if they're an essential employee, and they're going to give it to everybody that they're around. This is how this stuff spreads. Is it true that the virus does not survive in heat? That's what they're saying. They're saying that it doesn't survive, and that's why I think they're kind of looking forward to the summertime coming. It's kind of like the flu. We really don't have the flu in the summertime either, but they're also worried that it's going to pop back up in the fall when the temperature starts going back down. Okay, and there's final expenses. There's a number for final expenses over there. Now, there is and I do not have it wrote down here. Let me see if it's on this other page. On the governor's, if you guys don't have insurance, if you are having problems getting signed up on Medicaid or whatever, they've got this program right now where everybody can get health insurance. If you don't have it, I don't care if you make $500,000 a year. If you don't have insurance, you can call that number. It's on the governor's page, and sign up. And there's a website there, and you can sign up for health insurance, and they are approving people like that. It's just all you got to do is get your name on there, and they're approving everybody to the end of June. And from what I was told at the end of June, if we're still in the middle of all this, it's going to extend it on out further. So there's no reason for anybody not to have health insurance right now. I didn't even have health insurance, but I signed up on it. So I'm on this right now until I can get I'm working on getting my private practice open. So once I get that opened up and everything, I'll pick up some, my own private insurance. So, but right now I've got this. Everybody can get this. He wants everybody covered right now through all this in case somebody gets sick. So that way, that's one less thing for you to worry about. So, till next time, like I said, comment on this, throw me out some questions, send me questions in Messenger. We'll try. If I don't know the answer, I'll look it up or I'll call somebody and ask them and we'll figure it out. So, till next time, everybody be safe. Wear your mask when you're in public. Wash your hands. Use hand sanitizer. Don't wear your shoes in the house. Don't hang out with people that don't live with you. Do not get in the car with people that don't live with you. Social distance. Stay out of cough range. Don't let people cough or spit on you or anything like that. Not a good time to start new relationships. Sorry. But till next time, be safe, Southeast Kentucky.